Ever since I first came to YKHC, dental disease has been a huge problem for our youth. Actually, it's a problem for everybody, but especially for our children who have almost unregulated exposure to sugar sweetened drinks and candy. And we just were never able to keep up with the demand for treating cavities and oral health disease.
Alaska has the largest land area in the United States, but it is also one of the least populated states. Alaska has the highest percentage of Native Americans, with indigenous people making up over 20% of the state's population.
Life in the YK Delta is not the same as it has always been. One of the biggest changes is what children drink and eat. Elders in your community might have told you, in the past, Yupik people never got cavities. In fact, research from the early 1900s showed that people in the YK had no cavities. This is because the traditional Yupik diet doesn't have much sugar.
I actually started providing dental care in the YK Delta in Alaska Native communities. And I spent many trips providing dental care to children and teenagers. These are really remote communities without a lot of easy access to dentists. My name is Donald Chi. I'm a professor at the University of Washington. I'm a pediatric dentist, and I also do public health research here at the University of Washington.
Some of you may know I started off as a dentist, a part-time dentist here back in 2012. And one of the things we noticed was some of the challenges families were having with the drinks that you were giving your kid.
What I was really interested in dentistry is that prevention was possible.
Nobody really likes having to go to the dentist to get work done, especially when it means having to fly from the village to Bethel or even Anchorage. It's not always practical and certainly not cheap.
We cover a region the size of the state of Washington or Oregon. We compare to those frequently. We have 48 villages, not connected by road. All travel is by single or two-engine aircraft. And the biggest hindrance to obtaining medical care is the cost of flying.
One of the big factors that leads to tooth decay in vulnerable and minoritized communities is sugar, particularly sugar from fruit drinks like Tang and Kool-Aid.
So we wanted to find a way to give your kids healthier drinks. And so this is where the sugar-free Kool-Aid comes into place.
We held community meetings to start piecing together a program aimed at addressing these fruit drinks. We eventually got funding from NIH to do our study, which would help families learn about the effects of sugared fruit drinks and healthier beverages that they could give their kids to prevent tooth decay. The most compelling aspect of our program is its ability to address behaviors without relying on the dental care system. It empowers families to take control of a significant risk factor for tooth decay that currently dental offices can't tackle: sugar intake. Even with millions of dentists, the current dental care system is not equipped to help patients modify their sugar intake.
So what we're trying to do with our program is that we're trying to help families change a behavior. So drinking fruit drinks is a behavior. And so behaviors are really simple to identify, but they're much harder to change.
They've gotten so accustomed to helicopter research out here where the person just comes once, conducts their research, and maybe never comes back again. Until you get that kind of traction where they know you, they recognize you, they have trust in you, research is never very beneficial out here.
Has lots of sugar. Has lots of sugar, yes, exactly.
The complexity of both the problem and the solution really requires an interdisciplinary approach. And what that means is obviously our team has a dentist and has oral health expertise, but we really rely on our collaborators from outside of dentistry to help us build the intervention.
We had collaborators from a variety of diverse fields, including dentistry, psychology, public health, microbiology, statistics, and sociology, each of whom contributed their specialized knowledge. We also collaborated closely with the Yukon-Kuskokwim Health Corporation, as well as tribal councils in the local communities who provided crucial cultural and local insights. On the ground, local health aides, community health workers, and schools were vital to our efforts. Local stores and wholesale suppliers supported our logistical needs, ensuring that families had the sugar-free drinks to make the program a success.
So what we found was that there was no statistically significant difference between the two communities that got the program and the third community that did not. From September through March, which is the 6-month intervention time period, there were actually increases in sugar intake in all three communities. But what we found is that in our two communities that got the program, the increase wasn't as large. We don't have data to fully explain why sugar increased in all three communities, but we have some guesses. Our next step is to design broader programs aimed at preventing tooth decay.
Through studies like ours, we can enhance public health and expand our outreach to communities that are the most difficult to access. By focusing on underserved populations, we hope to make meaningful impact and foster lasting change.